Welcome to Medical Ward BSN 3F Group 3, second rotation NCM 116 Early Nursing Care Management 116 Early Medical Surgical Nursing 2, Virtual Clinical Duty. This is our second week, and of course our case scenario for this week is with patient CD diagnosed with brain tumor. But before that, allow me to share this premise. I am here for you. It's literally my life's work to help you grow. And of course, please allow me also to give you the learning outcomes for this week. On completion of this case study, student nurses will be able to first build knowledge related to the patient's medical experience. Second, to continue to develop a comprehensive assessment and monitoring skills. Third, recommend nursing interventions based on the case presented. Fourth, define the roles and the contributions of student nurses in the care of medical patients. And fifth, justify optimal therapy based on the current understanding of the case. So this will be the basis of our expected outcomes at the end of the case analysis. Just a reminder of the following instructions. All critical thinking questions presented within or after the case applies to this case study. You have to create a brief and to the point responses, and of course there has to be no flowery words. When asked to provide several answers, it must be listed in order of priority or level of significance. Base all your answers on the data that is presented and do not assume information that is not provided in the case. Further, please follow the format of your output, especially on its font style, font size, paper margin, paper size. Save this PDF file and submit all the requirements per group on date specified as its deadline. Send all the requirements via the official email address of your clinical instructor, and it is advised that you will submit all your requirements on or before the set deadline of submission. Furthermore, kindly follow this format in saving your requirements for easier monitoring. For daily requirements, you know that one already for the first week, and of course your weekly requirements also, you know that one in your first week. Let's now have your case scenario of patient CD with a brain tumor. Patient CD is a plain housewife, a 57-year-old Roman Catholic in faith, and is currently residing at Barangay Ipunan, Cagayan de Oro City. A happily married woman with grown children and 2 new grandchildren. Patient CD made an appointment with her optometrist to explore progressive left visual loss over a 9-month period. Her eye exam was essentially normal, and the optometrist referred her to a neurologist. After workup, a 2.5 centimeter brain mass was found and surgery was scheduled. Her past medical history is hypertension only, for which she takes long-acting metoprolol or Yotoprol XL 100 mg per day. Her past surgical history includes tonsillectomy and adenectomy as a child, cholecystectomy, and a total abdominal hysterectomy at age 42. She also takes a conjugated estrogen or Premarin 0.625 mg per day. Patient CD has craniectomy and is admitted to ICU postoperatively. She does very well and remains neurologically intact. She has 2 peripheral IVs, thromboembolus deterrent hose, oxygen at 4 liters per nasal cannula, and a Foley catheter. Vital signs: heart rate of 88 beats per minute, blood pressure of 147 over 68 millimeters mercury, respiratory rate of 18 breaths per minute, and laboratory testing includes potassium 2.7 millimole per liter, glucose of 202 milligrams per deciliter. Patient CD did suffer mild neurologic damage as a result of the surgery. She was discharged to a rehabilitation facility and eventually recovered most of her lost function. She continues to enjoy an active life and has become involved in helping others face similar experiences. Let us now have your high 5 critical thinking questions. Number 1. Name 1 test that can be done to evaluate for a brain tumor. Again, name 1 test that can be done to evaluate for a brain tumor. Number 2. Using the term benign when discussing brain tumors is somewhat misleading. Why? Number 2. Using the term benign when discussing brain tumors is somewhat misleading. Why? Number 3. Describe common psychological responses to a diagnosis of a brain tumor. Number 3. Describe common psychological responses to a diagnosis of a brain tumor. Number 4. List 6 general symptoms associated with many brain tumors that CD might exhibit. Number 4. List 6 general symptoms associated with many brain tumors that CD might exhibit. Number 5. Evaluate the status of CD's potassium and glucose values and identify what, if any, treatment is needed. Number 5, evaluate the status of CD's potassium and glucose values and identify what, if any, treatment is needed. Let's now have your daily requirements. For day 0, that's Sunday case scenario loading. Day 1, Monday, basic requirements includes specific objectives, daily plan of activities, your survey 1, nurse's notes, and FDAR for day 1. Initial knowledge about the case, physical assessment, pathophysiology, diagnostic test, and of course, your drug study. Day 2, Tuesday, basic requirement includes specific objectives, DPA, Survey 2, Nurse's Notes 2, weekly evaluation, reflective journal reading, critical thinking answers. And of course, you have to have your initial knowledge about the case. That includes problem lists, nursing care plan, discharge plan. Weekly requirements includes your introduction, nursing health history, physical assessment, anatomy physiology, pathophysiology, diagnostic test, drug study, problem list, nursing care plan, discharge plan, learning outcome, references, and that has to be in an APA style. Deadline of submission for day 1, March 8, 2021, Monday, 11:59 p.m. Day 2, March 9, 2021, Tuesday, 11:59 p.m. And for the week 2 requirements, deadline is March 13, 2021, Saturday, 11:59 p.m. We are all on our own journey, but in this class, we all need one another and will help one another grow. These are my contact details. This has been Yucef Bahian Abang at your service to make your best even better. To God be all the glory.